normally hospital administrators, and it's interesting myself being a hospital, a health system administrator now, rarely get down to the granular frontline level, right? And I think that is so key for our entire system, health system success, that will, and really our owner and CEO of the entire health system is down in the ED meeting with staff and engaging with staff. So it's very rare, if you go across the nation, for an emergency department frontline nurse or staff to have a kind of direct communication to senior leadership in the hospital or even in much less the health system. So I think that opening those communication channels was incredibly key. As a new health system that came in, we needed the frontline staff to be able to engage with us so we could truly assess what's going on. Like, what is the reality for that? What is that frontline reality for the patient? So I think that's been incredible. And I think, putting my, as an emergency department physician, if I was working in a department and I had that, have I ever had that level of communication? I haven't, and I'm happy to be in my position now that I can now provide that and recognize how important that is to our frontline staff. I think it's an interesting thing what's happening in healthcare right now, where increasingly hospitals and healthcare systems are being run by Wall Street, investment bankers, CPAs, operations people, business administrators, right? Where are the clinical folks? Where are the physicians and the nurses? So that's why my position is unique, and I really enjoy it, being that clinician who can translate to the administration world. And I think that's what we need more of. We need more physicians and nurses and clinical staff to take more charge of our destiny, because we're largely being, taken over by the financial world. The financial world is driving healthcare, and if we don't, as physicians and as nurses, if we don't step up and be able to translate our clinical priorities to the financial world, then I'm concerned about the direction of healthcare if we don't step up to the plate. Understanding, we talk about patient satisfaction all the time. And one of the metrics that we built in to measure ourselves against, and I challenge the team, that one of the metrics we're going to measure ourselves by is nursing and provider satisfaction as well. I think the only way you get, satisfied patients is if your nursing staff, your frontline staff is satisfied. Are they overworked? Are they overburdened? How do they feel about the culture of the place? Are they being treated with respect? That is so key to the culture of a department, because patients feel it, right? I mean, patients, when they come in, they can tell, and the energy that you exude as a provider, as a nurse, is palpable to the patient. And so that's why, really, for patient experience to be top-notch, the clinical provider experience and comfort. Now, they'll be working hard. And oftentimes what happens is, when you put systems and processes in place, you will be seeing more patients, but you'll feel less burden at the end. Everybody loves structure. And unfortunately, emergency departments, because of the nature of it, it's chaotic, but how do you put structure in that chaotic world is the challenge, and requires a very dedicated approach, which I'm happy to say that we've initiated here.